Good evening, and thank you for joining our series of conversations on mental health offered by the Sioux Falls School District with experts from Avera. My name is Jeremy Mollett, and tonight we will focus on the topic of gaming addiction. Over the past 2.5 years, the pandemic forced many children and teens to spend much more time at home, away from friends and activities. This not only led to an increase in social media usage, but also gaming. Tonight, we'll share some helpful advice on how the rise of video, computer, and mobile phone games is affecting children, how to address this with them, and what levels of care are available. At this time, I'd like to introduce Dr. James Nold, Assistant Superintendent of the Sioux Falls School District, to offer a welcome.
Good evening. On behalf of the Sioux Falls School District, I again want to welcome you to this 9-part presentation that is titled the Family Forum Series. First, I want to take this time and opportunity to thank Avera for their partnership with the Sioux Falls School District in providing this service to our families. This is the 4th installment of the series, and we hope that you have found the previous presentations and information to be of great benefit. You are welcome to join us the 3rd Tuesday of each month to hear information on a variety of topics that are intended to strengthen and support our families by providing information and resources that exist right here in our community. And now, I look forward to hearing from our presenter this evening, and please do not hesitate to provide us feedback on the Sioux Falls School District Let's Talk app that can be found at the Sioux Falls School District website. Thank you again, and now back to Jeremy to introduce this evening's presenter.
Thanks, Dr. Nold. We will now move to the presentation. We are pre-recording this session, so we'll not be taking live questions, but we will leave some time at the end to address some of the top concerns we hear from parents. Tonight's program will be presented by Dylan Strand. Dylan is a lead behavioral health tech at the Avera Addiction Care Center with Avera Behavioral Health Hospital. Welcome, Dylan, and thank you for presenting.
Thank you, Jeremy. I'm happy to be here and happy to kind of give some education on gaming addiction as a whole. There's not a lot known about it, so I want to talk directly to parents and family members about what to kind of look out for, some warning signs, what it looks like, and how we can potentially work to treat it if it is an issue. So video games, before we kind of jump into talking about video game and problematic video games, I just want to define what video games are when we're talking about this. So the definition of video game is defined as like electronically manipulating images produced by a computer program on a television or other display screen. So with that definition, there leaves a little bit of room for interpretation, right? There's a wide range of different things that can be classified as a video game. And in today's day and age, video games are very common, very prevalent. I mean, you can find video games wherever you look. Like if you're looking for one, you can find them. There's a lot of different gaming platforms out there. Smartphones are becoming probably the most common form of gaming just because people have it with them wherever they're at. Say you're waiting for a doctor's appointment, it's easy to pull out your phone and play a game. So this is actually the most common form of gaming is using a smartphone. You also have other mediums like personal computers, consoles like Xbox, PlayStation, Nintendo, iPads. I mean, you can even play video games through social media sites. They're really everywhere and super common in today's day and age. So as it becomes more accessible, you start to see some more problematic behaviors that can come along with that too. So video games have come a long way. As you can see in the slide, one of the first video games ever produced was Pong, where it's just 2 white lines on a screen hitting a ball back and forth. This was developed in the 1970s, and today there's a video game for everything. Any situation, any scenario, any way to pass the time, you can find a video game to kind of accommodate this. It is played by about 2.2 billion people worldwide, play video games. And as we know, the population just hit about 8 billion. So that's a little over a quarter of people in the world play video games. So that just shows how common it is. 3/4 of all Americans have at least one gamer in the household. And when I say gamer, I mean someone who plays video games on an average of 6 hours per week is what we usually look for that definition. According to the American Medical Association, 90% of American teens play digital games. That is a huge number. So as we start to look at this, as video games kind of go on the rise, become more accessible, we want to start to look at the behaviors that it may cause in some of our loved ones. And with it being a $90 billion industry here in the United States, this just shows that it's going to continue to be in our lives. Since it's generating so much revenue, people are going to find new ways to make video games more engaging, more products to kind of put out in the marketplace for people to consume. With this, I do want to also talk about some of the benefits that video games can potentially have with some people. I'm going to say this a few times throughout this presentation. It's about how you use them. And so video games can be very helpful with associating learning with video games, like learning new skills. You see a lot of video games out there that talk about like reading, math, comprehension, and they present those in an engaging way that kind of give positive feedback as one is learning and doing it, so that it keeps them engaged and focused on the material. Even video games are used to learn new languages, to reinforce that positive behavior and continue to come back to keep you engaged and motivated so that you don't fall away from it. It stimulates cognitive development by keeping people engaged. It can promote positive affect and well-being by giving people positive coping mechanisms, promoting psychological resilience. Video games, when used correctly, so to say, can be very helpful to have a positive distraction, just like exercising can, reading can, any other positive coping mechanism. Video games can be used in that same way too. It's just sometimes, like any other behaviors, when it's done too much or incorrectly, it can lead to some negative consequences and side effects, which can lead to problematic gaming. So as it was mentioned, COVID had a huge effect kind of on the amount of screen time that people are consuming and using. With being quarantined, being isolated, people had to turn to mediums in their own home to try to provide that helpful, positive distraction, new hobbies, new ways to pass the time. So stressors from the pandemic have contributed to increased addictive behaviors. So this is across the board with addiction. It's not just video games. We've also seen upticks in like substance use, alcohol use, opiate use, along with behavioral addictions like gambling and shopping, just due to the added stress. When there's a lot more stress and anxiety, it can lead people to turn to some forms of coping to help deal with what's going on. And COVID-19 had a huge impact on everyone's life, especially students having to switch to like online learning for that time period was a big stressor. And also trying to find ways to socialize too. And video games became an outlet for that too, with online gaming with other people. The World Health Organization warned that during the pandemic, there was an increased risk of screen time, and not just like binging Netflix, but social media time, playing video games, looking at a screen to pass the time. And so with this, it was shown that problematic gaming disorders increased by 1.6 times during this time span. And coping skills tend to stick. So what people used to cope to get through the pandemic, odds are they're still doing some of that in their day-to-day life. So when we talk about gaming as an addiction, we classify it along like an impulse control disorder. So when we talk about impulse control disorders, it's like behavioral addictions, like say food addictions, like binge eating or seeking out food as a form of comfort, gambling, sexual addiction, shopping addictions, where there's certain behaviors or compulsive behaviors that people are doing to try to feel better or to avoid negative emotions or situations. So gaming is really classified in that same kind of category as a impulse control disorder. I'm going to talk about a little bit about the differences between, say, like a substance use addiction and a gaming addiction and some of the debate that kind of is surrounding that. But we are going to talk about it in the context of an impulse control disorder. So what are some characteristics of problematic gaming? So when you see this in your loved ones, these are some consequences or things that can potentially pop up. It can be poor performance at work, school, around the home, maybe not doing chores, and then just always kind of focused and preoccupied with playing video games. Neglect of other hobbies and friendships, so really kind of isolating. Their only focus is playing video games. They fall off on doing the things they enjoyed doing. Maybe it was going out and playing sports with friends or hanging out with family members. Those things start to fall off as the problematic gaming increases. Decline in personal hygiene and grooming. Maybe they're not showering as much or brushing their teeth or brushing their hair. An inability to set limits on how much they are playing or how much they're using it. kind of that loss of control over it in a sense. Like say I'm only going to play for 2 hours today, but then they end up playing for 3 or 4. That's kind of an inability to maintain those limits and losing control over some of that behaviors. Signs of irritability, anxiety, or anger when forced to stop playing, even for brief periods of time, can be a symptom. The need to spend more time playing games or to play more intensely in order to kind of get that same level of enjoyment, almost like a psychological tolerance that goes along with that. Symptoms of physical or psychological withdrawal. So it could be like loss of appetite, sleepiness, becoming more agitated. With this form of addiction, gaming addiction, we see a lot more of those psychological withdrawals that can occur. And then using video games as a way to escape stressful situations at work or school or conflicts at home. So, I mean, this can be a positive, like using video games as a temporary escape. Like say you're in an uncomfortable situation or stressful situation you can't do much about in that moment. It can be a positive distraction to take you away from that stress and anxiety and bring you more into the present. And where it becomes harmful is when that becomes a nonstop kind of behavior, when they're doing it and completely avoiding the situation. Even when there are things they can do about it, they still choose to use video games over, say, positive outlets, like maybe they have to do something at school that's been stressing them out and they have to do a meeting with some classmates about it. And they avoid that to play video games because they don't want to deal with the stress at all. That's where it becomes problematic. But say 2 days before they're stressing out about the meeting they have with their classmates, they can use video games as a positive outlet to calm them down, remove that stress and anxiety. But when it's used as a constant avoidance, that's when it becomes an issue with this escape concept. So gaming and co-occurring disorders, when we talk about this, is it's shown that with problematic gaming disorders, there is a connection between different mental health disorders as well too. There has been some evidence associated with video game addiction and certain mental health disorders like depression, ADHD, obsessive compulsive disorder, autism spectrum disorder, and even anxiety. And whether like the cause and effect relationship of this is really unclear, like which one came first, the gaming or the mental health disorder. It's really hard to say. And this is a concept we see a lot, even with, say, substance use disorders like alcohol, methamphetamine, opiates. There is a strong connection between co-occurring mental health and the substance use disorder. The reason for this is because people tend to try to find outlets or means to like self-medicate their mental health disorder. So say depression, like low mood, low motivation, they're going to try to find ways to mask those uncomfortable feelings. So they may reach to substances or impulsive compulsive behaviors like this to help cope with it. So you do see a connection between co-occurring disorders and problematic gaming disorders as well. So there is a little controversy or debate when it comes to diagnosing video game addiction. So the Diagnostic and Statistical Manual of Mental Disorders, also known as the DSM-5, is kind of the American standard for psychiatry and psychological disorders. When looking to diagnose someone with a mental health disorder, this is the manual they turn to for that. And in this DSM-5, they included internet gaming disorder and problematic gaming as a condition that warrants more clinical research. So they want to learn more about it before they can put an official diagnosis on it. But they're coming out with new editions of this, and in the next one, it'll be interesting to see if they do move it to like a compulsive addiction disorder. However, the World Health Organization, they kind of have their own codes that they use for mental health diagnosis. And in 2018, they included gaming disorder alongside gambling under disorders that are due to addictive behaviors. So they recognize it as a clinically significant syndrome that needs treatment, needs certain courses of action to take care of it. There's a certain list of symptoms that goes along with it too. So you see in other countries that kind of go along in these kind of ICD codes have treatment centers set up, like in China and Japan, they do have inpatient treatments for gaming addiction, where here in the United States, it's not quite to that point. So there is a little bit of debate going along about whether this should be a diagnosable disorder or not. And so as time goes on, I would think it would fall into that category, but we will just have to kind of see when they come out with that next manual. So some of the reasons for that debate is there's some differences and similarities among addiction with video game or behavioral addictions and say like substance addiction to opiates, alcohol, methamphetamine, things of that nature. So some of the differences, some of the argument is it's hard to kind of measure a tolerance that goes along with gaming addiction. With substance use, it's a little bit easier because you can see they're taking this much in a day and then now they're taking this much in a day. So they need more to get that same effect. It's a little easier to measure. Where with video game addiction, if they're playing 6 to 7 hours a day and that's consistent, it's hard to see tolerance there because they're using the same amount. A lack of kind of physical withdrawal associated with it. So say with alcohol, when someone stops using, they may experience like shakes, tremors, sweats, stomach issues, loss of appetite, difficulty sleeping, and even in some severe cases like hallucinations and seizures. But with video game addiction, you see more of that psychological withdrawal. So it's hard to justify the need for medical intervention when they don't have those physical symptoms along with it. But you can definitely see irritability, inability to handle stress, things like that as some psychological withdrawal symptoms that go along with gaming. And it's not an intoxicant. It doesn't distort a person's perception or ability to coordinate day-to-day tasks. Similarities between the two. One of the biggest similarities between addiction and like gaming addiction and other compulsive behaviors is that it does activate the reward system of the brain, which causes the release of dopamine, which is a key player in any addiction. So what dopamine is it's naturally used by your body to tell you, hey, this is good for my survival. I need to keep doing this. So say you eat food that's good for you, your brain's going to release dopamine to tell you, hey, keep doing this. This is good for us. But when it comes to addictions, substance use, compulsive addictions, it tricks the brain into releasing dopamine to think, hey, this is important for our survival. We need to keep doing this. And sometimes it does this in greater amounts than, say, eating, taking care of yourself, doing the things you know that are healthy for you. So then your brain starts to prioritize these behaviors and substances over eating, taking care of yourself, all those kind of things. So video games do stimulate this part of the brain and do release dopamine in higher levels than other healthy behaviors. So that's why we can start to classify it as an addiction. Also, a key component is the concept of like obsessive preoccupation, constantly thinking about it, thinking about, oh, there's 30 minutes left at school. I'm going to go home. I'm going to sit down. I'm going to turn on my computer or console and I'm going to play video games for 4 hours or whatever that may be. They're constantly thinking about it throughout the day. They're thinking about how they can do it again or thinking about what it feels like when they are doing it. That's another symptom that really does correlate with addiction. And clinically significant impairments to all areas of life. So to their personal life, their family life, their social life, their education, they really start to see decreased levels of functioning in all these areas. So there are a lot of similarities and a few differences that are still kind of among that debate of classifying gaming as an official addiction. But it is definitely a problematic behavior that you can see those similarities popping up in. So if you're starting to wonder, does my child or loved one have a problematic gaming use, or is it kind of that normal pattern of playing video games? Because like we said, 90% of American teenagers play video games. So it's hard to differentiate, is this healthy or is this unhealthy? So here are a few questions that you can kind of ask whether or not this is problematic or not. Does the gaming get in the way of other important things in life, like relationships, school, work? Important things are given up because of their use or playing the games. Does it isolate the person from family or friends? Are they spending all their time in their room playing video games rather than coming out to dinner or doing family activities? Do they feel like they've crossed the line between enjoying to play the game and feeling like they have to play the game? Otherwise, they start to feel really anxious or irritable or angry. Might they be using gaming to avoid a deeper problem like depression, strong emotions, that unhealthy escape from what's going on in their life? Are people around them concerned about the amount of time they are playing games? So have you talked to your loved one saying, hey, I feel like you've been playing video games a little too much this last week. Can we cut back a little bit? And then they aren't receptive to that. They continue to do so. They see some consequences, but they continue to do the same level of video games they were before. Do they become upset or irritable when they're not playing the video games? Like you take the game away, they become really angry, potentially aggressive or violent when they don't have this outlet that they can use. Are they avoiding other activities they used to enjoy? Are they not spending time with friends? Are they not playing sports anymore if they were before? Are they skipping meals and only focusing on playing video games? Are they often tired because they're not getting enough sleep? Do they have physical problems that go along with it, like carpal tunnel syndrome, migraines, eye strain, but they continue to do so, continue to play games anyways? These are some questions you can ask to start to see if your loved one does have problematic gaming, because if they are experiencing consequences physically, socially, psychologically, and they continue to have that same behavior, that can be a little concerning. So studies show that with these problematic gaming disorders, people typically spend 8 to 10 hours a day or at least 30 hours a week playing video games. This isn't a definitive number. Say it's like, okay, my loved one's only playing 7 hours of video games a day. They don't have an issue. What it really comes down to is those questions we just talked about. How is it impacting their life? Is it having a negative impact on their life? Are they falling off and having poor grades at school because they're not doing their homework? Are they not socializing? Are they not eating, showering, taking care of themselves? That's really the indicator that it may be becoming an issue. One 2011 study showed that by playing video games, it increased gray matters in a specific area of the brain called the ventral striatum, and a change that may result from increased dopamine release. And this has been seen in gambling and other substance use disorders too. So this kind of shows, hey, this may be an addiction or compulsive behavior that we need to look into more and start to take seriously. So if someone does have problematic gaming or a gaming addiction, there can be some potential health risks that go along with that. So like a sedentary lifestyle, if they're just sitting playing video games all day long, they're not getting much physical exercise, they're probably not eating the greatest, which can lead to longer term health consequences like heart disease, diabetes, some things like that too. There's a loss of face-to-face social engagement. Maybe they have social engagement through like online playing, like playing online with a bunch of different people. That's how they have their friends or who they talk to. But they do lose out on some of those skills that go along with interacting with people face to face. Problems with concentration or attention, avoidance of developmental tasks, or if there is a predisposition, sometimes seizures or repetitive stress injuries. So with neurological disorders like epilepsy and whatnot, there is a higher risk of seizures with playing video games too. So with these, we talked about co-occurring disorders earlier too. It's important to really look at both of them, because is the, say, problems with concentration and attention due to ADHD or their video game use? It's important to take both of those factors because they do play heavily together. So you're starting to wonder, maybe you can start to identify this problematic behavior in your loved one, but then you start to think, okay, what can I do about this? What can we do if it is an issue? How can we help? Just work first to set limits on playing video games and stick to them. Boundaries is such a useful tool to utilize with your loved ones in this situation, because what boundaries teach them is what's acceptable and what's unacceptable. Their brains are still learning, they're still developing how to live, like what's important for our survival. What do I need to do, like, to keep me going? What's healthy for me? So we need to assist them with kind of setting boundaries and showing them, okay, this is what's healthy, and then this what may not be healthy. Keep phones and video game consoles out of their rooms or out of their bedrooms at night, so that they can really start to separate and establish those boundaries. Like if they're going into their room and laying down in bed, it really sets that pattern in their mind that, hey, it's time to sleep, get in that routine, that healthy sleep hygiene. But if they have their video game consoles in their room and they go in there and they are used to booting that up and starting to play that, their brain has that association with that as well, so it may be more difficult to fall asleep. Try to find everyday activities, including like exercise, socialization, getting active. This will lower the health risks of sitting and playing for long stretches of time. So just try to find more physical activity to mix in with their routine. Communicate them in a respectful manner and listen to them. This is such a big piece right here. You can help by staying calm and positive and encouraging them. So if you are concerned about your loved one's gaming behaviors, try to talk to them in a place of understanding. Try to avoid statements like you statements saying you are playing too much video game, you only do this, you aren't doing anything else. It has a lot of blame, kind of stigmatized with that. And so when someone hears that, defenses can come up real fast. So something you can do is really start to use I feel statements, saying it's like, I feel you haven't been spending as much time with the family and we miss you. Or I feel your schoolwork is starting to suffer. Are you playing too many video games? Like coming at them from a place of compassion and understanding is going to help that conversation flow a lot better than a place of criticism and kind of demeaning them for what they're doing. And then spend time interacting with your kids. This is such a big piece as well too, because children learn through socialization, like monkey see, monkey do sort of mindset. If they see you doing something, odds are they're going to start to learn how to cope with things in a certain way. So if you're spending time interacting with your children, say planning a game night, or planning going out and doing things together, whether it's the winter time right now, going ice skating or sledding, try to find these activities you can do as a family to interact and start to establish new ways of coping and new healthy behaviors. Because if a person only has one main coping skill to deal with stress, anxiety, maybe some mental health that's going on, it sets them up for failure, because in that's what they focus on. That's the only thing they're going to use. But if they have all these different tools in their tool bag, things they can use to deal with stress and anxiety or anything else that's going on, they can pick from a wide range of different things to help with different situations. So then you see lower risks of just that compulsive behavior and need to use just one. So interact with your children, spend time with them, teach them healthy habits and healthy ways to spend time together. And say you've tried all these things and it's still not working, really seek some professional help then, whether it's from a doctor, a therapist, a pediatrician, to really start to see, hey, maybe there are some underlying mental health going on, or maybe we do need to work professionally to change some of those thinking patterns that may be embedded in your children. So with that, it's important to know that this is a treatable condition. If you do have a loved one with a gaming addiction or problematic video game use, there are certain techniques that can be used to help change the way they think and the behaviors they're doing. One of these is called CBT, or cognitive behavioral therapy. This guides a person away from like obsessive thinking patterns and obsessive habits, and really starts to identify and replace them with healthier, more realistic options and thinking patterns. This should be done with licensed professionals, so like a therapist would be someone to go to for this. Group therapy can also be a very valuable resource. Provides like moral support. It can help outline or point out problematic behaviors or consequences someone may be experiencing. And it can also replace socialization skills or friends that may have been lost due to isolation and problematic gaming. Individual and family therapy can be helpful as well. Family therapy can help really open up communication and start to learn how to have healthy relationships with each other if that may have been damaged from problematic or gaming addiction. And if need be, if they do have an underlying mental health disorder, whether it's anxiety, bipolar, ADHD, obsessive compulsive disorder, any of them, it may be needed to be treated by medication therapy. Maybe they need some medications to help restore an imbalance that they have in their neurochemistry or their brain. So all these things are things you can use to help treat this if it is an issue in your life.
Mr. Strand, thank you for that presentation and that information. I know that it is a very valuable thing and a topic definitely that our parents have a great concern with and are involved with. We've seen that over the years in the school, and as a school administrator myself, that kids sometimes come to school tired, and sometimes their homework slips or things like that. But the parents are always worried, how heavily should they be involved? How heavily should they take an active role in their parents' use or in their child's use of gaming. And any thoughts or comments on that for our parents as far as how involved they should be?
Yeah, that's a really good question. And I can't stress this enough. Involvement is such a helpful tool because even if you're concerned about your loved one's gaming, even just saying that, hey, I'm concerned about what I'm seeing, this can start to plant the seeds in their mind about, okay, maybe this is an issue that we need to look at. So really starting to work with them, like setting limits on how much time to spend playing these different things, trying to incorporate new hobbies and things to do together to help replace old unhealthy habits is such a huge piece too. So parental involvement and family involvement is great. Like the more support someone can have to get through this, the better.
Thank you. One additional question we have that has come to us is kids change so much over time. You know, as we see kids that come from the elementary to the middle school to the high school, they truly just change so dynamically over time. How does a parent truly see those signs to know what's a normal change as they go through and progress, and what's something they should be very concerned about that may have to do with the gaming process?
So yeah, some definite things to look forward with that is how is it affecting them like developmentally? Like how is it affecting their life socially? Maybe their use has increased over time, but the main thing to look for is how is it affecting their life, their ability to have positive relationships, continue to do schoolwork and keep ahead of that is a big part of that. So just knowing that this is a common thing for kids to play video games, but how is it impacting their life? Is it becoming an obsession, like all they focus on and all they care about? Or are they still able to have healthy relationships, healthy activities? Those are some key things to keep in mind.
Thanks, Dylan. That was some really good information tonight. This session is going to be added to the Sioux Falls School District's website under counseling. We hope you'll join us for our next session, which will focus on how you can recognize the signs of unhealthy eating habits. This will be presented on Tuesday, January 17th from 6 to 7 p.m. and login information will be under the counseling services area on the school district's website. Thank you for joining us and have a great night.